why did you want to be 6 foot? Why couldn't you have remained 5'6"?
For me, it was, I went through most of my life, especially my teenage years, I went through most of my life basically feeling like I wasn't good enough. I was made to feel good enough, mainly by those who were close to me, like friends, family, all these different things. And my height was always the butt of the joke. So I did a lot of different things to improve myself, but for me, it was just never enough because height was still always that one thing that was kind of in the back of my mind.
The first thing I want to say is I am 6 feet tall, not 5'11", 6 feet tall. If you ever see me out, don't measure, because you'd just be wasting your time. We're going to come up with 6 feet every time, okay? I am very happy with how tall I am, but there's some guys out there who are not, and they want to get taller. And for those guys, there is a process where they can make that happen. Well, a surgery. It's called limb lengthening surgery. And one of the guys, Denzel Siggers, got that surgery. And we're going to hear more from him later on in the video. But I just want to say, any surgery you get, the first thing you should do is research. Your own personal research. And the first thing you should research is the surgery process. Like, exactly what is limb lengthening surgery?
It starts with breaking your bones. At its core, limb lengthening is a medical procedure designed to increase bone length. Originally developed to help people with medical conditions like dwarfism or leg length discrepancy, it's now also being used to fulfill one of humanity's oldest wishes, getting taller. How does it work? The break. It all starts in the operating room. The process starts with a procedure called osteotomy. That's a fancy way of saying that the surgeon breaks the bone. This must be done while leaving surrounding tissues like muscles, nerves, and blood vessels intact to ensure proper healing later. The tech. Once the bone is cut, an internal rod, used with or without an external frame, is attached to stabilize the bone and slowly stretch apart the two ends. These lengthening devices are the unsung heroes of this procedure. The lengthening phase. A few days after surgery, the real magic begins. The device starts stretching the bone, but don't imagine anything dramatic. This is a very slow process at only about 0.5 to 1 millimeter a day, depending on the doctor's prescription. As the gap between the bone ends widen, the body kicks into repair mode. Here's the science. First, the body creates a soft callus to fill the gap. This gel-like rubbery material is made of collagen and cartilage. It's essentially the body's blueprint for the new bone. Then, specialized cells called osteoblasts swoop in to convert the soft callus into hard bone. These cells deposit critical minerals like calcium and phosphate, solidifying the bone tissue. Meanwhile, osteoclasts break down any unnecessary material, ensuring everything is smooth and structured. But it's not just about the bones. Soft tissues like muscles, nerves, and blood vessels adapt to the new length as well. This can cause stiffness and tension, making physical therapy a must to maintain flexibility and avoid long-term issues. The consolidation phase. Once the desired length is reached, the consolidation phase begins. This is when the regenerated bone gradually hardens and strengthens. The end result? A longer, perfectly solid bone that's just as strong as the original.
The rehab after this surgery is not easy at all. You're going to have to basically live in the rehab center. Full recovery takes anywhere from 6 months to a year on average. Could be longer. So if you're one of those people who can't keep a job longer than 2 months, I'm telling you, this surgery is not for you. Because it's going to take work to come back and, get the strength in your legs again. Because some people who don't put in the full effort in rehab can't walk. And if you go through this whole process, you do not want to end up not being able to walk. But just because you put in full effort and you can walk, it doesn't mean you won't have complications. I mean, some men have this surgery and regret it. And here's some of the reasons why.
So the first reason why patients regret stature lengthening is due to complications. Despite the majority of successful surgeries we hear about, many patients have experienced unexpected complications during and after lengthening. From infections to nerve damage to muscle contractures that need soft tissue releases to malalignment to non-unions, you name it, it's most likely happened. And many of these complications can lead to long-lasting pain and discomfort, essentially crippling you. The next reason why patients have regretted their decision to get limb lengthening surgery was due to the fact that their proportions were skewed to the point where they just didn't like their look. You gotta remember that this is a cosmetic procedure and that aesthetics do come into play. So if you're particularly worried about your proportions almost as much as or more than the height that you're after, you could potentially cause some anxiety for yourself, essentially creating a proportion dysphoria. I've spoken to patients who've lengthened one bone segment, say their femurs about 8 centimeters or so, then they take a look after they're able to stand and walk, and well, they hate it. Most of these guys would typically opt to do the other bone segment, say their tibias, to help balance it out, while there was actually a few who've actually considered limb shortening to reverse the effect. Another reason why patients regretted lengthening was because they feel like they didn't get enough height. Most patients in this category either face some sort of complication, such as a severe muscle contracture, that forced them to stop, but there were a few who couldn't tolerate the rigors of lengthening, and even some who thought they were going to be satisfied with whatever length that they stopped at, only to realize that their dysphoric thoughts returned later on. In fact, I remember a patient who was lengthening his tibias, but the pain bothered him so much that he wanted to stop at 1 centimeter, like 1 centimeter. Then after he recovered a bit, he realized that he wasn't satisfied and he wanted more height and he wanted to go back, get a re-break and lengthen more. The only problem was that he had a slight axial deviation and an apex deformity on his tibia. So I'm not sure if this patient ever got that corrected and lengthened again, but he was definitely stressed by it all. And there were others who were just exhausted from the process and called it early. Limb lengthening is not an easy process by any means, but I think if you can manage your pain well early on, do your physical therapy, avoid complications, you'll make it through okay. You'll be really, really happy on the other side. Now, the final reason why patients regret stature lengthening is having unrealistic expectations. Many prospective patients might see a cool video online with some time lapse of other patients, and think, hey, look, that doesn't look so bad. I can just pay this much, get my legs broken like this and get back to normal life. Unfortunately, that's not how this works. This isn't a drive-through, it's a life-changing procedure, and something that big requires an all-in mentality. Patients in this category are those who don't consider the amount of time that it's going to take to get to full recovery, or just how limited their mobility is going to be and how difficult it's going to be to do things safely. The recovery process was much longer and challenging than he had anticipated, and it significantly impacted his daily life and career.
So have patience and a strong work ethic. Now, Denzel Siggers is a man who has both. In an interview earlier this year, he said he spends anywhere from 4 to 8 hours a day in the gym.
How much time do you spend in the gym?
It just depends on the day. It depends between like 4 to 8, sometimes more.
4 to 8 hours.
4 to 8 hours.
Now, he had his surgery back in 2022, but a profile was done on him 2.5 months after his surgery. So let's take a look at that.
I'm Denzel Siggers. I'm 27 years old and I spent $100,000 on limb lengthening surgery. When I first woke up, I just asked myself 1,000,001 questions. I was like, why did I do this surgery? I regretted it. I shouldn't have done it. I'm in so much pain. I've never felt this kind of pain before, and is it really worth it? And I thought something was wrong because I didn't think it was normal to feel this amount of pain. There's a metal rod in my leg, and then there was an external fixator that attaches to the metal rod going through your leg. So you have both an internal device and an external device. It was very shocking. It felt unreal to see it attach myself because I had never seen anything like this before. I was actually in a relationship prior to the surgery. Once I told her I wanted to go get surgery to get taller to boost my confidence, she was completely against it. And inevitably, we ended up ending the relationship, even though she was someone that made a lot of jokes about my height herself. So she hasn't seen me, but she's just seen like my social media and she's been trying to call. She's been trying to make her way back, but that's somewhere I don't want to go back to.
When it comes down to it, that's what it's all about with men most of the time, right? Attracting women, because a lot of women out here won't give these short guys a chance at all. But what confuses me is he had a woman before he started or before he thought about doing this. And it seemed like to me, she liked him for him, but he would rather go get a woman who likes him because of his height. I don't know. But I will say this. I was short growing up, okay? I was 5 feet tall, probably, until the summer before 11th grade. And that's when I had my growth spurt. And seeing that I have seen both sides of this coin, I can tell you honestly, the world is a little different up here. It is.
The world is a much different place now that I'm taller. People smile at me everywhere I go. I've never had this kind of like reaction from people before, and I really enjoy it. I've always been very unhappy with my height, pretty much my entire life. I realized I was short around 15 years old, and ever since then it's kind of weighed on me. I tried a lot of different things to make me taller, or at least appear taller, such as spinal decompression, put insoles in my shoes, inversion tables, and they would only give me about an inch more. As far as my recovery process, I work out every day. I'm just restricted in some of my abilities like squatting. Recovery takes about 6 months to a year. I'm much further ahead at my current stage than most people would be. It's only been about 2.5 months since I completed surgery. I can pretty much do everything that I need to do for the most part on a normal day-to-day basis, so I'm very pleased with where I'm at. The surgery has significantly boosted my self-esteem, mainly because everything I had to go through to get the height, so I appreciate it more. But just being home and seeing how the world reacts to me at 6 foot rather than 5'5" has been like a very amazing experience for me. I've always been like an outgoing person, but now I can just be myself without caring what people think or what people have to say. I'm me all the time now, rather than hiding behind like insecurities.
Now, I don't know about all that. Like, like his 6 feet is different than my 6 feet, because I don't see people out there, you know, treating me differently because I'm 6 feet. The only difference treating I get is, I know I get to tap on my shoulder in the grocery store and say, hey, can you get that up there for me? That's the only difference I see, but maybe because, you know, his 6 feet is new and mine has grown over time. So I don't know. I just want to get this message across though. It's totally normal for you to care about what other people think of you. But it only becomes a problem when you let someone's opinion affect your happiness. The trick is to find a balance. Try to focus on the opinions of people who really matter to you and let the rest go. Now, it's easier said than done. I know that, but it's about training yourself to value your own opinion over everybody else's. When you're able to do that, I mean, life just becomes so much easier. Like, some short men out there are extremely confident. They're not affected by what other people think of them, and they will never even think about getting this surgery.
The question that I often get here is whether or not I'd ever consider limb lengthening surgery, and I'll give you a list of reasons as to why I'm not a fan. Starting with the fact that, number one, it's high cost, high risk, low reward. It's invasive, it often involves multiple procedures and requires months to years of, you guessed it, painful recovery. You also have the privilege, but not the obligation, to experience nerve damage, infection, limited mobility, and long-term complications. The cost can also exceed over $100,000, and it doesn't guarantee satisfaction or improve self-esteem. Number two, it doesn't address the root mental struggle. Truth is, the issue many short men face isn't their height. It's actually the internalized shame or rejection that is tied to it. Rejection is part of life. Surgery doesn't teach you how to build confidence, form healthy relationships, or improve your self-image. Many men still experience insecurity post-surgery because the emotional root hasn't been addressed. And number three, it reinforces the belief that you're not enough. Choosing surgery as the fix can validate harmful societal messaging such as you need to change your body to be worthy, which means that every time you reinforce that belief, well, you're committing to self-confidence delete. Sounds great, doesn't it? So if you'd ever ask me, the 5'3" guy, if I'd ever consider limb lengthening surgery to appease to someone else's insecurity about me, well, the short answer is no. But what do I know?
Well, that's all for this video. Let me know your thoughts in the comment section below. Give me that thumbs up. Don't forget to subscribe, and I'll see you on the next one.